Yes, Mohammad Yasir Rafiq.
Hello,
Hello,
sir.
Mr.
Assalamu
Yasir.
alaikum. Assalamu alaikum, sir.
Walaikum Assalam.
Oh,
How
sir.
are you?
I'm fine, sir. I can't
Yes,
believe myself that I'm talking with Dr. Najeeb.
You cannot believe yourself you're talking to Dr. Najeeb.
I start
Why? Because
palpitation.
you are
I'm
expecting
so
me with lot of
no, sir. I'm so blessed, sir. I really love you, sir.
Oh, thank you very much for your love and support. Thank you very much.
Okay, sir.
When I talk to my students, it
Yes,
gives
sir.
me so much endorphins that after teaching for so many hours,
yes,
all my tiredness is finished.
oh,
I feel when student like you I talk,
yes,
I'm showering into endorphins.
oh no, sir. Like
showers of endorphins are going on.
I'm studying in Ukraine, sir, and from the first year I'm just watching your videos, and whenever I'm watching your videos, I have you can see the all the notes and every card, and you can see, sir, sir, the cardiology notes.
Oh my God, you made so many cardiac cycle notes.
Yes, sir. And yes, after that, I have a very crystal clear concept. And I told my friend also that in my graduation, I told like first thing I will say that I thanks Dr. Najeeb. Sorry, sir. Thank you, sir. I'm a bit nervous. I'm coming to the question, sir. Don't be nervous. Okay, sir. Just get relaxed. Okay, sir. Thank you. Yes, just be easy. It's okay. Okay, sir. Thank you. Thank you so much. Sir, as you mentioned that in the well-fed state, like the insulin is shooted after eating or anything. So, sir, what is the main role of C-peptide? Like it is the indicator there. You mentioned that, but very good. Your question is that after taking meal, insulin levels increase. Yes, sir. Of course they do. Yeah. Initially very high and then moderately high. Yeah. Because initially high levels are due to the pre-stored insulin and later delayed moderate raise is due to newly synthesized insulin. Okay. But your question is that what is the role of C-peptide? Yeah, yes, sir. Right? Exactly. Previously, we thought that it has no function. Okay. But now we are discovering even its receptors. Okay. And as I mentioned in previous lectures, that C-peptide has 7-pass receptors on endothelial cells, and when it binds with the endothelial cells, it forces them to activate their nitric oxide synthase enzyme. Okay, sir. And when nitric oxide synthase enzymes are activated, that arginine can be converted into nitric oxide, and that nitric oxide basically help the vessels to have antithrombotic lining. Okay. And also keep the vessel dilated so that physical pressure or flow pressures on the endothelium is less. Okay. So in a way, by forcing the vessel, C-peptide, forcing the vessel endothelium to produce more nitric oxide, right, makes the endothelial cell less sticky to the platelets. Okay. And also keep the vessels relaxed so that flow shearness or flow dynamics are relatively soft on the vessel wall. Both these things are vasculoprotective. Okay, sir. Right? So actually, let me tell you that they are even now trying to make drugs. Okay. They are under trials which mimic as analog of C-peptide. Okay, sir. Right? We don't know. Maybe in few years, such drugs come which are similar to C-peptide, but a lot of research and work is going on. And so, what is you mentioned that the hepatocyte does not destroy the C-peptides. I didn't get it that time. Oh yes, I mentioned that hepatocyte and insulin both are going in equal amount in the portal vein. Yeah. But in the liver, about 50% of insulin is destroyed. Yeah. Right? Yes, sir. By enzyme insulinase. So it means that insulin concentration in the systemic circulation is not true representative of endogenous insulin release. Yes, sir. Right? Yes, exactly. Because almost half of it is destroyed by the liver. Yes, sir. And again, how much is exactly destroyed, it depends on the type of food and state of the liver health, and so many other factors. Yes, sir. But C-peptide, when it is passing through the liver vasculature and sinusoids and all those areas, actually in our body, up to now they claim that there's no destruction of C-peptide, and C-peptide as such appears in urine as a very small peptide. Okay, sir. Right? So C-peptide level in systemic circulation, if you take from my vein blood,
the C-peptide will more accurately reflect on the endogenous release of insulin than the insulin itself present in the systemic circulation.
Okay, sir. Okay, sir. Thank you. Thank you so much, sir.
Is it clear?
Yes, sir.
You're welcome.
My day is going to be great. Thank you so much.
Have a great day.
Okay, sir.